Hello, I'm Dr.Parinaaz Parhar, Clinical Head at Oasis Fertility, Secunderabad. Today I'll be talking about how does IVF differ from an IUI. To understand this, let's just talk about the two procedures in brief. IUI usually involves the female patient receiving about 5 days of oral medications which are used for stimulation of the ovaries. In some patients, they might need about 1 or 2 injections to help with the growth of the follicles. The patient is called for scans once in about 3 days to monitor the growth of the eggs, and once the follicles are about 17 to 20 millimeters in size, she is given an ovulation trigger. Once the ovulation, that is the release of the egg from the ovary, is confirmed on ultrasound scan, the husband of the patient is asked to give a semen sample. This semen sample is processed in the laboratory in order to get a good concentrate of sperms, and then this sample is inseminated into the female's uterus as close to ovulation as possible. Following this, patient is given some medications for supporting a pregnancy and asked to get a pregnancy test done after about 14 days. The success rate of the procedure is about 15 to 20%. IVF or in vitro fertilization, on the other hand, usually has a target of making as many follicles as can be seen on the scan grow. Whereas in an IUI cycle, we were looking at making at least about 1 or 2 eggs grow. In IVF, the more the better. So obviously, to make as many eggs grow, we need a higher dose and duration of injections. So patients on an average need about 10 to 12 days of stimulation. Following the stimulation, the patient is regularly called for scans to monitor the growth of the follicles, and once again, when the follicles are 17 to 20 millimeters, the ovulation trigger is given. Now here's where the difference comes between IUI and IVF. Instead of waiting for the egg to be released naturally, the patient undergoes an oocyte retrieval procedure under anesthesia, strictly 36 hours after the ovulation trigger. Whereas in IUI, we are dependent on the egg getting released naturally. In IVF, all our efforts are concentrated on preventing the egg from undergoing premature luteinization and from being released. The trigger injection is just given in order to help with the maturity of the eggs. Once the eggs are retrieved, the husband is asked to give the semen sample. The egg is fertilized with the sperm in the laboratory, and the resultant embryo is cultured in the lab for about 3 to 5 days. Once the female's lining is considered ready, this embryo is then transferred into the uterus. As we can understand from the procedure of IVF, it differs from IUI because we are not dependent on ovulation. We are trying to avoid ovulation. There is no role of the tubes. For pregnancy to happen, you don't need patent tubes, unlike in IUI, where fertilization of the egg and the sperm will happen only if the tubes are patent. So for patients where there is a tubal factor, IVF is an excellent option. Also, to allow IUI, the male factors, the male partner's semen concentrate should be of a certain standard. He needs to have at least 10 million sperms, 10 million motile sperms post-processing to help the partner achieve pregnancy if we are going for IUI. However, for IVF, a sperm count of as less as 5 million will also result in success. Anything less than that, you can go for an ICSI, and it's very easy to achieve success in IVF. The success rate of an IUI is almost about 15%, like I already said. For an IVF, it can be as high as 40 to 50%. For those patients, sometimes in IUI cycles, the success rate is not very good because the follicle might be ready, but the endometrium is very thin. In IVF, you can have the option of going for a frozen embryo transfer. So, suppose if you feel that you have got a required number of eggs, but the patient's lining is not good, you can freeze the embryos. And on the next cycle, just focus on developing the lining and transfer the embryos. That way, you still give the patient a good chance of success. Again, IVF wins here. You can almost see that the success rate of IUI, 3 IUIs is equal to 1 IVF. Then why don't we do IVF for everyone? Simple reason being that it's an expensive and labor-intensive procedure. So we try to go in a stepwise fashion where we try the simpler treatment first, unless the patient has a very obvious cause of infertility which stands to benefit only from IVF.